Hi guys, it's Dave. Today we're going to talk about Buerger's disease. It's kind of a rare disease, but it's also kind of a weird disease. It's almost exclusively seen in tobacco users, especially smokers. But you can also see it in people that chew, as well as long-term marijuana users. It's seen there. What happens is it affects your blood vessels, and most commonly in your arms and your legs. They swell up, making it hard for circulation to go through and for blood flow to occur, which causes clots. The tobacco causes somehow, they aren't really sure how, causes damage to the lining of the blood vessel walls. And that's what causes the inflammation, which causes your decreased circulation. There's pain, tissue damage, leading to infections, which can lead to gangrene when the tissue dies, which then, of course, with gangrene, you may need to have your toe, foot, finger, hand amputated. It usually will show up first in your toes and your feet, but again, you can see it in your fingers and hands or in both. Patients are almost, like I said, always smokers or chewers. There is some genetic component to it. However, mainly it's going to be making you as a smoker more prone to it with the genetic component. They also have seen that they're investigating the possibility that it may have some autoimmune issues with it as well. Not enough studies has been done on that, but they do see that maybe the body is attacking itself. Quitting is really the only way to treat this disease. You need to stop chewing, you need to stop smoking. And the weird thing is that even if you cut back, say you're half a pack a smoker a day, and you cut it back to a quarter of a pack or even one cigarette, you still are not going to get remission of this disease. It's still going to occur. You're still going to be prone to having blood clots. Things like nicotine lozenges, nicotine patches, nicotine gum can also cause this disease. So you really want to get totally off, quit totally off of it. You may look at things like bupropion or Chantix, or just getting into a support group or a therapist to help you quit. That is the most important thing. Symptoms. What happens initially, like I say, you see it mainly to start in your toes, tingling, numbness in the fingers and toes, or some burning. You can see a change in your skin color in your hands and your feet. That can be hard to see, especially if you have more melanin in your skin to begin with. Then you may see some Raynaud's type symptoms. So if it gets cold, your fingers and toes can turn white, then blue, with numbness and pain in both. You can see pain in your feet and ankles, making it difficult to walk. Very painful to walk. It can also go into your knees as well. You will see open sores on your toes, on your feet, in your hands that just don't heal. So if you're a diabetic, you really do not want to get this disease, which means it's really important to quit smoking as soon as you can, or chewing. And being a diabetic, you don't want to be a smoker or a chewer anyway. What happens, you'll see some swelling in the vein just below the skin, like a regular blood clot would be, where you'll have redness, some puffiness, some heat, some pain. If that occurs, get into the doctor, the emergency room right away. Along with having being a smoker or tobacco user, other risk factors that you can see is being male, less than 40 years old, not greater. Most commonly this shows up between the ages of 20 and 45. So less than 40 years old, that's going to be your main hotspot for getting this disease. As far as complications, like I said, gangrene, which can lead to the loss of toes, fingers, hand, foot. But you could also see stroke, heart attack, nervous system issues, as well as gastrointestinal issues. Stopping smoking can actually put this disease in remission, where you'll get the blood circulation back going again, where you can lead a normal life like you did before. They may want to treat you with anticoagulants, blood thinners like warfarin, Eliquis, Xarelto, things like that. They can put you on pain meds, most commonly non-steroidals like ibuprofen or naproxen, because those thin the blood as well. And they may also put you on vasodilator like calcium channel blockers, so something like verapamil or amlodipine, to help get those blood vessels back open so the circulation can get going. But some things that you can do to help yourself out are to exercise. Get out, get moving. That will get the circulation going. Compression hose for both your arms and your legs. Things like fish oil will help with circulation as well. They may end up needing to do surgery on you, though, to get those veins opened up. But again, in closing, quitting smoking is the best and really only treatment to stop this disease and to prevent it.